Okay, good morning, everyone. We're gonna get started here with our Economic Opportunity Advisory Council meeting for today, Tuesday, April the 16th, 2019. And I would ask if everyone would please join me in the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible. And please join us in a moment of silence thinking about all the brave men and women of our great United States military that serve us here and abroad, and also our Sheriff's Department, first responders, and all our local police forces for keeping us safe here in Flagler County. Okay, thank you. First item is approval of our meeting minutes from March the 19th, 2019. Entertain a motion on that.
Motion to approve.
And a motion and a second. Call the question. All those in favor of approval of the minutes of March the 19th, please signify by saying aye. Aye. Unopposed, that motion carries unanimously.
I'm sorry, we don't have a quorum, so we're going to have to hold off on approving those minutes until the next meeting when we do have a quorum. We can't take any votes at this point.
Oh. Yeah, okay. Thanks, Katrina. Are we expecting a quorum, or this is what we have today?
I think this is what we have today. I did not hear back from Mr. Federline.
Okay. All right, that's fine. All right.
That was someone else who sent an email around who said they had.
Okay, all right.
What's our quorum number?
5.
5.
So if someone could motion to table it till the next meeting, please.
Motion doesn't carry any weight.
Right.
A quorum.
Okay, thank you. Okay, so we're going to kind of move along with presentations, and we're pleased to have and fortunate to have Mr. Bob Snyder this morning talk with us. He's the director of the Flagler County Health Department, and Mr. Snyder was appointed as administrator for the health department in 2015. Bob, is that correct? Okay. He brings more than 30 years of hospital management experience to the position. Prior to coming to the Department of Health in Flagler, he served in several capacities for Orlando Health, a network of community and specialty hospitals based in Orlando. In 2002, Mr. Snyder began as administrator of ancillary and support services for Dr. P. Phillips Hospital, formerly Orlando Regional Sand Lake Hospital. He then served as administrator of master faculty planning in 2006 at Orlando Regional Medical Center, and as president, vice president, and chief operating officer for South Seminole Hospital from 2009 to 2012. Between 1982 and 2008, Mr. Snyder held executive and management level positions at several hospitals, including associate executive director at Humana Hospital, Bennett, chief executive and operating officer at Waterman Medical Center, and administrator at Memorial Hospital, Flagler. So welcome, Mr. Snyder.
Thank you, Commissioner. Bob Snyder, administrator of the Department of Health, and I see half of you at least on a regular basis, so you've seen a lot of this presentation before, but thank you for the opportunity, and we'll breeze right through this, and we'll highlight parts that I think will be pertinent to economic development in our community. So thank you. Okay. I think everyone agrees with me that one of the most important things that we strive for is good health, because good health equates to a happy life. We had a drone shot of our group. By the way, with me today is Gretchen Smith, our public information officer, and Gretchen's husband, Charles, took a drone shot of our team that is growing, by the way. Our team is growing because the last 3 to 4 years we have grown services that the health department's been providing the community, and I'll mention that in a moment. We touched the lives of almost 10,000 people in 2018 and provided 158,000 varied variety of services, which you'll see in a moment as well. Broad scope of services. including prenatal care and family planning, immunizations, of course, the WIC program that I'm sure you've heard about. We're one of the largest dental practices, by the way, in Flagler County. Children who are on Medicaid, we are their dental home. 2 dentists, a team of about 10 people altogether, include dentists and dental hygienists. A lot of activity, a lot of projects we have going on with Flagler schools, which I'll mention. Of course, one of our biggest tasks is to track, investigate, and monitor communicable disease. And if we have an outbreak of any kind, we're the first responders to work with the community to end the outbreak. We screen, treat, and conduct surveillance for STD, of course, which, by the way, is rising in all the counties in the state of Florida, and it's a national trend as well. Chlamydia in particular. HIV, we've done a great job the last 2 to 3 years in bringing HIV services to the community. Just 3 years ago, the Volusia County Health Department took care of all of the individuals with HIV in our community, and with transportation being an issue, we got together with Dr. Stephen Bickle, our medical director, and we decided to open up our own HIV clinic for Flagler County residents dealing with the virus. And great health outcomes here. 98.7% of all of our HIV patients that we treat in Flagler County, their viral loads are imperceptible, meaning there is no trace of having the virus because of the treatment regimen that we've been able to initiate. So proud of that outcome. Yes, we still have tuberculosis, and we do have an increase in hepatitis A and hepatitis C that is impacting the state of Florida, and that's a national trend as well. So we are coming up with a plan to deal with hepatitis A in particular, and we just got a United Way grant to increase the number of hepatitis C patients that we can treat in the community. Emergency preparedness and special needs sheltering. You all know Commissioner O'Brien has seen our team in action when there's a hurricane, Matthew and Irma. We take care of the most vulnerable in our community at Rimfire Elementary. And hopefully we won't have to do that anytime soon. Yes. The newest program that we initiated is diabetes self-management training and education. 14% of our population in Flagler County are impacted by diabetes. And so we're over the state average for that. And we noticed that we have no one in the community providing services like this. 1 in 3 adults have onset diabetes. They have pre-diabetes. So we've partnered with the Adventist Health Foundation, the Adventist Health Medical Group, their team of 17 primary care physicians, urgent care centers. And January 1, we began our DSME and diabetes prevention program to try to do something about this chronic disease. To get word out and to improve outreach and marketing, we initiated, I think we're the only health department in the state of Florida to have a weekly radio show dedicated to the public health of our community. It's called Flagler Health Matters. I think some of you have been a guest on Gretchen's show. It's heard every Saturday, WNZF, from 11:30 to noon. We tape it during the week, and that will be held weekly. And there's a shot of our Director of Nurses and Dr. Stephen Bickle, our Medical Director and HIV Clinic Director, and our Gretchen. Our partnerships are critical, and all of you are our partners. I mean, I just see a few there. Of course, the county, the city, the municipalities, Flagler Cares, Advent Health, the hospital, the foundation, the Diabetes Alliance. We're just fortunate to have wonderful people that we team up with to improve the health of our community. I mentioned the special needs sheltering already. Some of our accomplishments, this has to do with our partnership with the school system. The school system had a contract just 2 years ago with a private company to provide flu vaccines for students and teachers. And we noticed that only 500 people were immunized last year or the year before. So we got with the school system to ask if we could take over that function and responsibility. Happy to report that 1,300 people got the flu vaccine this year through the school system. Dental sealant program, that was new. Oral health care is an issue in our community, especially with children. You'd be surprised. The second biggest reason why someone goes to see a school health nurse at school is because of a toothache. So we began a dental sealant program at 3 schools, and going to be starting a 4th one this coming next school year. And over 1,000 children have gotten their teeth sealed, not to prevent them from talking, but to prevent cavities. So we're real pleased with that program.
Bob, can I ask you a question before you move on?
Yes.
I see under the mandated screenings, scoliosis. I was recently made aware that a lot of students get scoliosis from carrying their book bags on one shoulder
kidding,
all the
Barbara.
time,
Yeah.
and they don't get correction with their young bones. And what other reason would they have that on there, scoliosis screening?
I'll have to get back to you on that.
I don't know if that's
Yeah.
the reason, but that's what I was told.
Yeah, not sure. I just know that for many, many, many years, this has been the mandated screenings that by statute the health department is to oversee for all schools in the state of Florida, these 4 indicators. So I could find out more about that. But anyway, you can see our results. We need to be providing vision, hearing, scoliosis, and body mass index screening for at least 95%. So we've beat all the targets there. Okay, so this is the part that I think is applicable for sure to economic development. So every year, the University of Wisconsin and the Robert Wood Johnson Foundation, they get together and they basically review a huge database, huge national database on health outcomes and health indicators for all the counties in the country. And we compare them against all the counties in their state. So just 5 years ago, Flagler County was the 27th healthiest community in the state of Florida, and we have improved ever since. In 2017, we were ranked 14th. And now we are ranked 9th. We finally cracked the top 10. And I think this is something to celebrate, whether it has to do with economic development or, encouraging other activities in our community. I think this is something that's really neat. This shows the health outcomes for the counties that touch us. Putnam is the 66th healthiest community out of 67. They have their challenges. St. John's is number 1, has been number 1 8 years in a row, and Volusia is 46th. Now, these health outcomes are based upon 2 broad-based categories, length of life and quality of life. And when you take them separately, you can see that Flagler's ranked 23rd for length of life, and we're ranked 7th for quality of life. And those are the indicators that improve the most. So let me give you an example. Under length of life, one of the subcategories is infant mortality. Well, for the past 2 years in a row, the African American infant mortality in the county of Flagler has been 0, 2 years in a row. There's no county our size that can say that. So that's an example of an improvement that has propelled us up to be number 9. Yes, so mortality is an important indicator for that, quality of life. And then other health factors are taken into account as well, like health behaviors, access to clinical care. What's the ratio of doctors and dentists to population in the community? We pretty much have stayed the same when it comes to health behaviors. The percentage of us that smoke, drink, sexually transmitted disease, bad behaviors, we're pretty much have stayed the same.
Bob,
Yes.
I apologize.
Yes, Don.
the red would be moving in the wrong direction on this?
Correct.
And
Correct. The red means that we're above the state average.
okay.
Yep. And green means that we beat the state average.
Interesting on the care side, where we have challenges. It looks like on the physicians, dentists,
Yes.
and mental health providers.
Yeah, we've improved. Dr. Jimenez and the hospital and the Advent Health Medical Group, they've done a great job in bringing new doctors and specialists to our community, but the data does show that there's still a huge shortage, especially with primary care doctors, dentists, and mental health providers for sure.
Can you speak to mental health a little bit more? What you're doing and where we stand?
Yeah, the Department of Health, we don't take direct responsibility for improving or providing services for mental health or substance abuse or alcohol abuse. That's more the purview of the Department of Children and Families for those services. But we are well aware of the opioid crisis. There's an opioid task force, and there's people who are meeting to see what we can do to address that. And we're big supporters of Stewart-Marchman Act. That's the largest mental health provider in our community. And through collaborative organizations like Flagler Cares, we have an opportunity the health department does to monitor, to see what's happening in that area. And so more funding has been passed in this coming budget, state budget. More national funding is coming to supplement those existing providers in our community to do something more about adult and youth behavioral health. So more money is coming. And so we need to be cheerleaders for groups like Stewart-Marchman to provide more services here in our community. Because all the indicators do show that that is where we're lacking mental health services for people with mental health conditions, of course, substance abuse and alcohol abuse. More needs to happen here in the county. So we're glad more funding is coming.
Thank you.
And of course, socioeconomic conditions have a lot to do, of what your health outcomes are. Where you live, work, and play does matter. Remember, I showed you St. John's as the healthiest community in the state? Well, guess what? St. John's has the lowest unemployment rate, they have the highest household income, and they have the largest penetration of people who have health insurance in the state. So it's not a surprise, I don't think, that they're the #1 healthiest community. And then just some other health indicators and health outcomes. I won't go through every one, but just wanted to point out that when it comes to mortality, cancer is the #1 cause of death in Flagler County, followed by heart disease. Usually it's the other way around nationally. Cancer is #2, but it's #1 in our community. And let's just talk about one more thing here. I know you've all heard of Flagler Cares. Flagler Cares is the group that organizes and prepares and works with the hospitals in town, Halifax Health and Advent Health, Palm Coast, and the health department to coordinate our community health assessment and community health improvement plan process. And it's a 3-year cycle event, planning event, and we're going to be starting that real soon, like next month. And I know some of you will be at those meetings. But the last time we all got together as a community to pour over 300 points of data and look at the results of a community survey, these were the 5 health priorities in Flagler County: adult mental health, youth behavioral health, diabetes and cardiovascular disease, care for mothers and children under age 5, and domestic violence. So I can tell you that something has been happening through the efforts of Flagler Cares as an organizing force and different partners and different groups in the community addressing each and every one of these issues. I'm just going to mention a couple, and we'll close. Suicide prevention. We have the unfortunate distinction of having the highest suicide rate in the state of Florida. Thus the importance, Mike, of mental health services, more of that coming to Flagler. So what happened was 3 partners within the Flagler Cares group and coalition, Lynette Schott from the school system, Colleen Conklin, school board member, and Carrie Baird, executive director of Flagler Cares. They said, we're going to do something about this. So they created a website. They created a Flagler Lifeline to raise the awareness of suicide. They've been out in the community and they've done presentations to many groups. We've done, mental health exercises and through a survey and questionnaire at First Fridays just to see, what's the status of mental health of those that were just curious and were looking for help. And so a lot has been done with suicide prevention to raise awareness. I already mentioned the fact that we started a diabetes program in coordination with partners the health department has. A large $700,000 grant was received to add mental health providers in our school system so that if a child is in crisis, they're not immediately Baker acted to the hospital. We now have mental health assistance for them right there on the premises. So that's because of this $700,000 grant. And I'll just mention the fact that when Sheriff Staley came on board, within 2 months of him taking office, he noticed how much domestic violence has skyrocketed in our community, and the data does show that. So he had a summit, domestic violence summit, and I think they recently had a meeting about a month or 2 ago to talk about some of the actions that have been taken to address this problem in our community, including rehab for jail inmates at the jail. But anyway, I'll stop right there. Thank you for your attention, and we are just so happy to have this opportunity. And I think that it's worthy to look at marketing and sharing the good news that as a community we're the 9th healthiest in the state of Florida.
Hey, Bob. Fascinating. Thank you. So I've been watching and reading about measles. How are we doing on measles?
Oh, I'm so glad you brought that up, Mike. Yeah. So remember I mentioned there's some things we need to improve here in Flagler, and one of the data points that we're concerned about, Barbara heard this yesterday, is that of all the 67 counties, Mike, we have the second highest religious exemption rate in the state of Florida.
Wow.
And it's unfortunate. Sarasota's number 1.
For inoculations.
For inoculations, correct. And so we have a pretty large vocal contingent of anti-vacciners here in Flagler County, because that's what parents do. A lot of younger parents, they read what they read on the internet, and they're convinced that vaccines cause autism and other medical issues, and they stand in the sand, and you just can't get through to them because they read something and it backs up what they believe. So we have quite a job of educating and informing, and we're going to be starting that process actually with the school board on May 16th. Dr. Bickle's going to be with us, and we're going to talk to the school board about some of the neat accomplishments we've had as a health department and a school system, like dental sealants. But we're also going to talk about this problem of immunizations. I think the timing is good because there's been measles outbreaks in about 4 or 5 states nationally. So this immunization and measles outbreaks have received
Florida was
a lot
on
of
the map
attention.
last night.
Was that?
Florida was on the map
Yeah,
last
Florida
night.
was on the map. Yeah, we're one of about 25 counties that
And
It's worldwide.
have had outbreaks.
And it's concerning because of the strong correlation between our population and New York,
Right.
with
Exactly.
relatives and people visiting, and where
But they're also talking about foreign travel. It's epidemic in many foreign countries, Europe, a
right,
lot of other
Barbara.
places that are just having a really tough time with it.
So if you have travelers here.
Right.
Absolutely.
Yeah, you
So
might
it's-
not
And it's an issue of, something like measles. These are all preventable, communicable diseases, every single one of them. Immunization, vaccinations was regarded as one of the 10 largest public health accomplishments in the 20th century. And we're now in the 21st century. And for an intelligent community like us to not embrace the concept and importance of vaccines across the board and just get that religious exemption rate down to, the last county, that's the goal here. Because, that we're putting a child at harm and we're putting other children at harm and other adults as well.
So I wanted to follow up on that. So when did measles vaccinations start? We've got a population, I'm in my 60s, late 60s. I don't even know whether I was vaccinated for measles or not. But if I wasn't, am I at risk? I was?
Yes.
Okay, good.
Yeah, if you had it, you're fine.
If I had measles.
Right, correct.
As a kid.
Now, you can get a booster vaccine, a booster shot, if you'd like.
Okay.
I doubt that you have to do that.
Okay, great. Good. Thank you.
On the radio show that I heard this morning where they were talking about the outbreak across the country, including the other countries that are being devastated by it, they talked about the fact that adults need boosters.
Yes. Yeah, and I've read that. I read that just yesterday. That's why I mentioned it. Yep, that it's not harmful to get a booster shot at all. So we're going to use good folks like Dr. Stephen Bickel to try to get through to some leaders in our community who have a firm anti-vaccine notion as well. And so that's where we're going to start. We're going to talk to the school board about HPV, adolescent vaccines. It is a national goal, and it's a state public health goal to improve significantly the number of middle school children that we provide the HPV vaccine for to prevent cancer later in life, cervical cancer in particular. And there's a 99% success rate with this vaccine, and it's a national and state goal, and I'm going to be asking the school board to come join us in that quest, in that purpose. And because all we want is parental consent. Parental consent for a flu vaccine, parental consent for the HPV vaccine. That's all we're asking for. And if 10 parents consent, we're pretty darn happy. So, but the more, the better.
Thank you.
Great question.
Jim?
Yeah, Bob, kind of a real basic question. I'm almost embarrassed to ask, but early on in your presentation, you talked about the medical and dental services you provide. Mm-hmm. Who's eligible? Who are the candidates to receive those types of services?
Right. We take care of the underserved, the underinsured, and those with Medicaid. I would say the Medicaid population, Jim, in our community is our targeted population. The free clinic, they take care of folks who have no insurance, but many of the folks that we take care of. If someone came in need no insurance, of course, and they're dealing with STD, HIV, they're pregnant, we take care of them. We don't have a birthing hospital here in the community, and we have 2 wonderful birthing hospitals in Daytona. And so it is the lifeline for prenatal care is the health department. And that's why we're so proud of that 0 infant mortality rate for African Americans. That's pretty special.
Bob, just for the record, and if you, I'm not asking for exact numbers, but can you just kind of give a breakdown of where your funding comes from?
Sure. That's an excellent question, too. Okay. Did you ever hear of, I know you've read in the paper about the education system and how poorly ranked Flagler County is when it comes to education dollars per student? It's the same thing with health care and public health. So real quick, our revenue sources come from 5 different streams. Federal grants for like the WIC program. We get a small contribution from the county commissioners, which we really appreciate. Medicaid funding, because we do bill for Medicaid, and then state general revenue. State general revenue comes in two forms. The first form is categorical programmatic revenue that's tied to a specific program. For example, like STD services, like school health, like the dental program. Then the other is the biggest chunk that we get, and that's called non-categorical general revenue. Well, I've been fighting for the last 3.5 years with my colleagues and people I deal with in Tallahassee to get that formula changed for how non-categorical general revenue is doled out. It's not fair. And so I'm working on that. And I did try for 3.5 years to get through to the last Surgeon General. And so I'm awaiting the appointment. Well, the governor did appoint the new Surgeon General. So one of the first things I'm going to talk to the new Surgeon General about is this disparity in funding issue. And the reason for it is because the formulas used for doling out money is based on population figures that date back to 1980, when our population here was 11,000 people, and we're now 110,000 people. So
Bob,
I'm working on it.
Did I hear or read that the new Surgeon General is a pediatrician by
Yes.
training? And so would that not afford some greater knowledge on the need for child services?
I would think so, Barbara. I would think so. His name is Dr. Scott Rifkes. He's a pediatric endocrinologist from the University of Florida Shands. And, he definitely would have a special understanding of the need for public health fair funding. And we'll try to get through to him.
I haven't paid attention on your side of it, but how are things progressing from the legislative side this session, or from the budgeting side?
I did review that yesterday. The Senate and House budget and the governor's recommendations show no decrease in funding. So no increase in funding, but no decrease in funding for public health. So, and more and more funding for substance abuse, the opioid crisis, and mental health.
Did they raise funding for health departments across the board during all the Zika scare, or was that just... No,
okay. They did not. Nope.
Any other questions? Thanks very much for coming this morning, Bob. Appreciate it.
Thank you, Don. Appreciate it.
Okay.
Y'all have a great day.
Nice to see you, Gretchen. Okay. Looks like next on our agenda is Executive Director Report. Anything, Katrina, to pinch hit on?
I do. Thank you. Helga's not here today, obviously. She is en route from Atlanta, where she was presenting Flagler County in the third phase elimination of Project Heidi. This time we went up to them, and Helga spent the day in meetings and presentations, and they presented to her. And then last night she got an opportunity to meet some of the principals in the project. I have not heard back from her about how that went. I did hear how the meetings went. The next thing I have to report on is we were gone to the MRO trade show conference in Atlanta last week. A lot of time spent up in Atlanta lately, which is a maintenance, repair, and overhaul trade show for aviation. We came back with a lot of good leads. We had actually hired a lead generation company to set us up with interviews while we were there to go ahead and vet some of the companies. We've already followed up with 3, and we will hear back from them shortly. So we will continue to work on those leads. The thing with MRO is, even though it's maintenance, repair, and overhaul of aviation, they don't necessarily have to be at the airport. So, for example, if it's engine repair and refurbishment, the engine can be shipped to these companies wherever they're located, as long as logistically they are situated well. So The other thing and the last thing that I need to speak about is our Opportunity Zone. We're moving right along with our Opportunity Zone strategic plan. We got approval from the Board of County Commissioners to hire Camoin. Helga reported on that last week. We've had our first site visit with them. They came, they interviewed stakeholders and business leaders in the community, kind of got a feel for what the vision for the town center is, and just for the people who are listening. An Opportunity Zone is a federal program. It's new this year. It takes capital gains and reinvests them into a redevelopment area or a development area, and you don't pay capital gains tax on that capital gains as long as you keep it in the program for 10 years. Our Opportunity Zone is town center. It was the designated Opportunity Zone, which is very unusual because usually it's an area that's blighted and needs redevelopment. What we have is a pristine piece of land that had stalled development due to the recession, and it's now starting to develop. There's a few residential projects going on out there right now. The first
Katrina, can I
Yes,
jump in?
please.
So I had an interesting lunch yesterday where we were kind of spitballing some ideas about economic development in general, and one of the things that we discussed was, as you know, I think we ought to be trying to troll the state public procurement opportunities and identifying, vendors and helping our local businesses win some of these nice state contracts. One of the spitball ideas was working with the state, and the state normally on these competitive bids will have a scoring matrix where they weight various factors, price being one, capability for sure, but local delivery is also a big one. The idea was include Opportunity Zone, give it some weight in the scoring matrix, and then if you do that, we've got an Opportunity Zone, and so if somebody can pick up 5 points on their scoring matrix by locating this, sourcing a delivery from an Opportunity Zone, they get bonus points. And I don't know how close we, the county, are to what the state is or isn't doing in terms of public procurement, but it seems to me we've got an opportunity if the state would be amenable to, include that as a scoring reference. A lot of times they have meeby-weeby scoring bonus points and so forth, and Opportunity Zone seems to fit pretty neatly with that if the state was so inclined to do it. So something to maybe look at.
It's a good suggestion. We are hosting 3 different meetings. We're having our second site visit with the Camoin consultants. The first meeting is going to be with developers. That's on April 25th at 9 a.m., Hammock Beach. Now, what happens with the Opportunity Zone funds is once you take those capital gains, you reinvest them into a project, a development project, and that's where that money stays until that project is completed. In 10 years, you can withdraw your money and not pay capital gains tax. So we have an opportunity. We have investors that have their capital gains, and then we have projects. So part of the Opportunity Zone strategy is to meet these investors up with these developers. So we are, like I said, hosting the very first meeting at 9 a.m. at Hammock Beach Resort for the developers on April 25th. The very same day at 3 p.m., we are going to have an investors meeting. Camoin's going to do the presentation of both of these, actually all 3 of these. The 3 p.m. investors meeting is going to be held at Creekside Golf Course. Thank you to Mr. Gill. He made those arrangements.
Creek course.
Not Creekside, but Creek Course.
Creek Course, excuse me, Creek Course. So and thank you to Mr. Gill for that. The public meeting, the general public meeting, is going to be held April 26th at 9 a.m. That one is going to be at the Community Center Room at the Palm Coast City Hall. Because the Opportunity Zone is town center, and it's within the city of Palm Coast. We are working very, very closely with city staff and the elected officials over there. And it's really been, it's actually a lot of fun working together and something. This is a very big project, and if we get to see it through all the way to the end and we can get some of these projects up and off the ground and start going vertical with this development due to this Opportunity Zone designation, we're really going to see a change in the makeup of the county at that point. And that is all I have to report on. Does anyone have questions? Fantastic. Thank you.
If I'd known that, I had to prepare a question just to throw you. Okay, thank you, Katrina. Appreciate you doing that for us this morning. Any comments or questions from council?
Only comment is it's never over till it's over, but some of the really egregious bills that were trying to make their way through the Florida legislature that would basically destroy home rule with regard to short-term, transient rentals seems to have stalled, and at least that's the word we're getting, and they're ready for next year. But that's good news.
Yes, sir.
And just for economic development purposes, I would like to invite any listener to please continue to frequent the Flagler Beach businesses that are having a real tough time right now with all of the work along A1A. I mean, just come out for a drive to come down and see the operation. I'm sure that the contractors would not appreciate adding more traffic to the parts of A1A that you can drive on, but it is a fascinating bit of work getting the seawall that we were told we were not going to have. But still, all of the businesses would really love to see you still come out and frequent them.
Okay, thank you, Barbara. Anything else? If not, open it up to public comment. I don't see we have too many folks here this morning other than you, Dr. Jimenez. Would care to say anything, or are you just visiting this morning? Okay, well, thank you. And welcome.
Because you're going to bring us a great opportunity, right?
We'll see about that.
Okay. If no one approaches the podium, I'll close public comment. Announce that our next meeting is scheduled for May the 21st at 9 a.m. here in the chambers. And if nothing else, I'll just entertain a motion to adjourn.
Second.
All right, we're adjourned. Thanks.
All right.